time for surgery soon. Is anyone coming to this meeting?
Running all the way, Julia.
I thought we were waiting for the computer to print out.
Yeah, but it's taking ages for some reason. Why don't we just get started?
Well, let's go with these for the moment.
With these? What, you mean there's more?
Another forest disappeared.
Julia, is this meeting going to take long? Because I'm on call today, you know.
Well, it won't if we get started. Quick as you can, Donna.
Well, you're obviously not going to tell me, so I'm going to have to ask you.
Ask me what?
Ask me what? Your date with Leo. Come on, there's no point me playing Cupid if you're not going to dish the dirt.
Well, it was nice. It's early days.
How early? Peck on the cheek early, or been coming in for coffee early?
I'm not telling you.
Oh, there was a coffee moment. Sorry, I was wondering if it might be possible to see a doctor, please.
No, we're fully booked this morning. If you give me your name, I might be able to fit you in tomorrow.
No, actually, I'm miles from home, Plymouth. It's... I had a heart up 6 weeks ago. I'm getting really bad chest pains.
OK, I better get you seen to. What's your name, please?
Ian Brogan.
OK, Mr Brogan, if you just take a seat for me, I'll see if the doctor can fit you in as an emergency. Are you well enough to fill a form out?
If I have to.
Oh, you're going to have to turn that off in here, I'm afraid.
Will do.
Right. Who needs to sign up for the asthma clinic, please? Oh, thank you.
Well, the Heart Week went well in terms of numbers, but according to these figures, we now have another 30% with BP problems, which we're going to have to sort out before we can reach our target. Mind you, that does seem very high to me.
Oh, yeah, it's shocking, isn't it? Maybe we should only take on patients with a normal blood pressure. I mean, these ill people are really messing up our stats.
They're joking apart. I mean, treating them is one thing, Julia, but getting them to come back and record the results is another.
Especially when they feel better.
Well, you know, if we don't achieve our targets on this, then we don't get the money. And this is not the only area where we're falling short. There is also... Hang on a second. Where is she with those figures?
Probably on the phone.
I wouldn't normally interrupt you, but he's had a heart up and he did look very peaky.
It's okay, you did the right thing. Which one is he?
Oh, he's not here now.
Right, obviously serious then.
Well, maybe he's in the toilets.
Well, whatever, if he is, just send him through next.
Well, I can't. I've got to nip into the partners' meeting for a few minutes. Can't you just go into the gents and have a quick look for me? His name's Ian Brogan.
Yep, I've nothing better to do.
Michelle, can you come and cover me on reception for a bit? Thank you.
I was a little concerned about the atmosphere around here last week.
Yeah, it wasn't too brilliant, was it?
And I thought we could do a little morale-boosting exercise.
What kind of exercise? I don't want one of those bonding weekends. Nick will have a field day.
No, I've got a much simpler idea.
Ah, at last. Thank you.
Sorry, I had trouble with a patient.
Come on then, Joe. Enlighten us.
Well, I was thinking of 360-degree appraisals.
Excellent idea.
Is it? What are they?
Sorry, can I interrupt? Look, I know I was supposed to be taking notes, but that was before I got delayed and I should be on the desk now.
Well, can't Michelle help out?
Well, she's there now, but she can't cover for long.
Oh, well, look, 5 minutes isn't going to make any difference. Here, just take a few bullet points. OK, Joe, carry on.
Well, they're all-round appraisals. I did one at my last practice, and it worked really well. We all pair off, and then we ask each other questions about how we think we're performing.
And that's supposed to help how?
Well, I know it sounds like a recipe for disaster, but in the long term, isn't it always better to know what people are thinking?
Well, we've got to do something after last week.
Well, I think it's a great idea. It'd be good for some of us to realise how hard other people work.
Look, but I'm right in the middle of the Carter case.
Paula, it's got nothing to do with me. The super wants our top female officer in on her interview. And since she's busy, he's had to plumb for you.
Oh, Fanny. I'm finally getting somewhere with the Carter case and the...
Paula! Watch me lips, pet. Leo Jackson has spoken. We do not ask why we jump, we merely ask how high. Anyway, you should be honoured, man. We've been waiting months to catch Teresa in possession. This is high profile.
Well, and the Katia Zitek murder isn't.
I've told you, it's a done deal. If it helps to ease the blow, I won't be around to oversee this case, so I'll see if I can upgrade you to an acting DI on it, all right?
Thanks.
No, don't thank me. It's enough just to see the look of gratitude on your little face. Right, we've just got to get the lovely Teresa cleared by the quack, and then she's all yours. So, get reading.
Oh, hiya. How's it going?
As good as it forgets.
Do you think someone can help me?
Yeah, come to my room.
Okay, lie down here for me. What's your name?
Ian Brogan. Triple bypass.
Okay, how long ago?
6 weeks. I went in last week. Check-up. They said I shouldn't travel, but I felt okay this morning.
His pulse is really slow.
Ian? Ian, can you hear me? He's arrested.
There's no output.
Right, we need help. Call the paramedics.
There's no one around. Okay. Okay.
I have to do it in a minute then.
If I could have those notes by the end of the day, please, Donna.
Yeah, I'll do my best.
Donna, if anyone wants me, I'll be in the police station.
And if you could sort out the pairings for the assessments as well, that would be a great help.
You want me to do that as well?
Well, if you could. Oh, and I don't think partners should assess other partners, so keep Julia, Greg and me apart, please. Thanks.
Yeah, fine, I'll get onto it.
What?
Nothing, it's just different from a training exercise.
Just go for it.
Clear?
Okay.
Yep.
So what kind of questions should we ask?
I've got the forms I used last time somewhere. I'll dig them out. Part of it is a list of set questions, and then after that it's up to the individual to talk about whatever they want, things that matter to them.
Oh, I don't know if that's a good idea. Michelle will be asking everyone about their sex lives.
It's a very short interview in my case. What's happened?
Just came out off the street and collapsed on us.
Told her the triple heart bypass, that's all we got out of him.
What rhythm's in?
VF, I've already shoved him twice at 200. I was going to try 360. What do you think?
OK, let's get a line in. He needs adrenaline, 1 milligram.
Charge at 360. Stay clear.
No, nothing. We need that Venflon.
Okay, I've only got one pair of hands.
Has anyone called an ambulance?
No time.
Really? I was just wondering... Oh, no, it's here.
Do you know him?
Oh, no, not really. His name's Ian Brogan. He came in earlier looking for a doctor, but then he disappeared. Is he going to be all right?
It's difficult to say.
Joe, another 360.
After the adrenaline.
Donna, we need that ambulance.
Charge at 360. Stay clear.
What have I done?
You haven't done anything, Donna. We looked for him and he'd gone.
Come on, Donna, let's get out of here. Leave him to work.
He's still on VF. Give him 600 micrograms of atropine.
Yeah, it's the Mill Health Centre. Yep. OK, thank you very much. Bye.
I sent Jimmy into the toilets to look for him, and then I came into you. Yeah, maybe I should have gone outside to find him or something.
Donna, come on. You weren't to know. Anyway, it might not have made any difference. He was ill when he came in here.
Yeah, maybe. But you know, if I'd have been in reception instead of your stupid partners meeting, I'd have seen him come back in.
Her name's Teresa Asprey. She looks harmless enough, but actually she's the local female Fagin, if you know what I mean. We've been trying to catch her in possession for months, but now she's saying she's too unwell to be interviewed.
Have you contacted her own doctor?
Oddly enough, for a woman who's supposedly dead on her feet, she hasn't got one. But basically, she's just trying to get out of being interviewed. So, your mission for today, should you choose to accept it, is to declare her fit for interview.
My mission is to give a professional, unbiased opinion.
Doc, she's a low-life pusher who gets kids to sell drugs to other kids. We don't need to be impartial on this. We need to interview her today before her cronies can shift all the gear she's hiding and then move out.
I'll let you know as soon as I've examined her.
No, not me, Doc. I'm tied up on the Carter case.
So, who's the officer in charge?
Acting D.I. Daniels.
I'm thrilled.
That's over 20 minutes. He's gone.
We need to call it a day. He's got no output, Jimmy. He's dead.
Time of death, 10:21.
Look, this has nothing to do with wanting a woman officer on the interviewing team. Look, I've been sidelined.
Sounds like it's a pretty big case to me. Maybe you should take it as a compliment that the super wants you on it.
Look, it's nothing to do with Leo Jackson. This is Squires trying to get me off the Carter case so he could take all the credit for himself.
Paula, you don't know that.
Look, I've had some CCTV coverage of the car park come in, but Squires doesn't know about this yet. I need to get it to a lab and get it enhanced so I can view it properly.
I don't need to know this, Paula.
Look, don't you see I just need today? If you examine Teresa and she turns out to be unfit for interview until, say, tomorrow, then I might be able to find Katya's killer.
I hope you're not asking me to falsify a medical assessment.
We couldn't save him, I'm afraid.
Oh, poor bloke. I mean, he'd kind of been more than 50.
45. His wallet was in his back pocket. Chief Petty Officer Ian Brogan, Naval Internal Logistics Office, Plymouth. Well, I'll sort out the coroner and the police, and then I'll give the Navy a ring, see if we can track down his next of kin, unless you'd prefer to do that.
Oh, no, you go ahead, thanks.
I only ask because one of us will have to see the rest of the patients.
No, I'll be fine. I'd much rather see patients than spend hours on the phone.
OK, I'll crack on.
Sure you're okay with that, Jimmy? You all right, Michelle?
Yeah, I've seen a dead body before.
I haven't.
Oh, Donna, so sorry I didn't realise. Listen, would you like to go home for the rest of the day? Be okay.
No, I don't want to be on my own, really. And, you know, it's all part of the job. I've got to get used to it. Look, let's all just carry on, yeah?
Right, well, I'll look at the nurse's room then.
Okay, let's all get on then, shall we?
The way I see it is if I carry on working, it might help take my mind off it.
Exactly. Mr. Saunders, please.
Can I help you?
I hope so. Our dad came in here ages ago. His name's Ian Brogan. You don't know where he is, do you?
Ian Brogan. Do you know, I don't actually...
I'm really sorry, Mr. Saunders. Could you just give me a moment? Hi, I'm Dr. Clay. Your dad is here, but if you could just take a seat, we'll be with you in a moment.
Cheers. Tell him to hurry up.
Right.
I just want to get this over with.
You okay?
He's got kids.
Well, don't say anything for now. I'll go and tell Julia.
Would you like a drink while you're waiting?
Why? Is he going to be long?
I don't know.
I don't care how long it's going to be. I'll have whatever's on offer.
Okay. I won't be long.
I've located 2 of his family.
Have you? Where?
In reception, he's got 2 daughters in tow.
Right. Slight complications, then?
Yeah, you could say that. I'll take them to my office and break the news to them.
Yeah. No. Hang on a minute. This guy's just walked in off the street. We don't know anything about him or his children. I think the police and social services should handle this.
Oh, you can't do that. It could take them hours to get someone down here.
Well, you don't know that.
I could take an educated guess.
Well, let's phone them first and get their take on things.
There you go.
Thanks. Did you find out where he is?
Sorry?
Our dad. That's why we're here, yeah?
I don't really know where he is.
Aren't you the receptionist here?
Yes.
Then how come you don't know where one of your patients is?
I wasn't on the desk earlier.
Must be with the doctor, though, yeah?
Yes, I suppose so.
So, can't you just ask? I mean, how many doctors do you have?
I'll just try and find out for you.
What is she on?
Don't knock it. Free drinks. Better than the doctors at home.
Whatever.
What's happening?
They're ringing social services to come in for them, so we're not to say anything.
What? That could take all day?
I know.
Oh, do you know, I don't think I'm up to this. I've just given them drinks, but the eldest is already asking questions. I've just said he's in with the doctor.
Well, just let them think that, and don't give them any special treatment in the meantime or they'll get suspicious.
Oh, I think it's too late for that.
Mr. Saunders, please.
What are you doing?
I'm getting on. There's not much else I can do.
How is she, Doc? Clean bill of health?
She's fit to be interviewed, yes.
Excellent. Paula, well, what are you?
Thanks.
I have to do my job too, Paula.
I know, I'm sorry.
Anyway, listen, maybe this case could do with your special skills after all. Judging by the time I've just had with her, she's going to be a very slippery customer. She's just tried every trick in the book to say she's too ill to be interviewed.
Well, she's going to get her wish. She can stay and stew in her cell for a while. I'm just taking a few hours out to catch up with my new case. See you later.
This is ridiculous.
Couldn't agree more.
I know Julia and Joe think they're playing it. You can't just let them sit there and say nothing.
I can see their point of view, and we don't know anything about him, let alone his kids. Do you know if there's a mother on the scene?
Or we could just ask.
Well, if you ask them, they'll definitely know something's wrong.
Well, they don't know.
Any luck with social services, Julia?
Well, yeah, they said sometime this afternoon.
Well, how long is sometime? Don't you think this is really unfair on them?
I don't know. But just prefer to wait.
Well, I'm sorry, this is my call. It has to be.
Well, how do you reckon that?
She's my patient.
Oh, come on, Jimmy, that's not quite right.
Yeah, okay, whatever. I just know that I'd want to know if I was them.
How do you know that?
My mum died when I was 8. I had people pussyfooting around me for days before they told me how well she was, and hours before they told me she died. It was over 20 years ago. I still remember what it was like sitting for hours in that hospital with nobody telling me a thing. Everyone thinks when you're a kid you don't understand, but you do. Now, please, just let me tell them. Let them cope their way. Show them some respect. Man, I know I'm right about this.
I better go with him.
Hi, I'm Dr. Clay. We spoke earlier. Do you want to come through?
Can we get another drink now, please?
Yeah, I don't see why not. Come through to the staff room. Sorry, I didn't catch your names.
She's Maxine. I'm Demi. I'm named after Demi Moore.
Shut up, Demi. He doesn't want to know that. Have you been treating my dad?
Yeah.
Is he going to be all right? Because we're meant to be seeing my mum ages ago.
Does your mum live locally, Demi?
Sort of. We're picking her up to take her home.
Oh, where from?
The manor.
At the Manor Hospital.
Yeah. She's an alkie.
She is not Maxine. Dad says you've got to stop saying that. She's got better. That's why she's coming home.
Hi, girls. Would you like a biscuit? Chocolate chip?
Can I have a word? Maybe we should wait.
What? Why?
Because they've got a mother that's nearby.
In a rehab unit?
In a rehab unit that she appears to be leaving. What do you think, Joe?
Well, I'm not up to speed here. What's this about a mother?
The mother's being treated at the manor for alcoholism.
Look, what's going on? I'm not stupid, you know. What's happened to my dad?
When your dad came in earlier, he had a very serious heart attack. And I'm afraid he's died.
You mean he died before we even came in?
Yes.
And you just let us sit there?
We wanted to tell you sooner, Maxine, but we just didn't know what to do for the best. He didn't even have time to tell us that you were with him.
Well, we did everything we could. We couldn't save him.
Like what? I mean, are you sure he's dead?
Of course he's dead, you moron. They're not gonna lie to us.
I'm sorry. We did everything we could.
Why didn't you try to save him? You did. Why don't you listen?
She's just upset.
We honestly tried everything. You can see him if you want to.
I don't know.
I don't want to see him. I just want my mummy.
Oh, yeah, of course you do.
I'll ring the manor. See if she's available. What's her name?
Jessica Brogan. I won't bother. She won't be up to it. She didn't do emotional stuff.
Well, we're going to have to contact her anyway, Maxine. She has a right to know as well.
Let's get one thing straight. She's got no rights. She hasn't been around for the last 6 months. She couldn't even bother to be there when Dad was ill. Navy had to send us to boarding school.
That's because she wasn't better. She is now. I want to see her.
You will. Don't worry.
I'm not waiting for her. I want to see his body now. On my own.
You sure?
He sent us to the shops. Said he wouldn't be long, just wanted to get himself checked out. I didn't even get to say goodbye. Just walked off.
I'm sorry. Just didn't have a chance to tell us anything.
He was in the Gulf War, you know. All those years away fighting, and he survives to come home to my mum. No wonder he had a bad heart. The stress must have killed him. He's got the right idea. Get out. I'm not gonna stay around either.
What's up?
You can live with her, I'm not.
Maxine, wait!
No, I'll deal with it.
So, have you managed to make a list for the appraisals yet?
You're not serious?
Well, I'm just asking.
Do you know what, Juliet? Yeah, I will do that. When I've done everything else I've got to do.
Thanks.
Where do you think you're going, Maxine?
Anywhere my mum isn't.
Well, your mum isn't here yet.
She will be though, won't she? She's the only adult left to look after us now.
You're going to need someone around.
Not her. I'm not a kid anymore. I'm 16 next year. I can look after myself.
Well, running off like a kid's going to prove that, is it?
I don't care.
You won't get far anyway.
I don't want to live with her again. She'll just start drinking.
You don't know that. She's more than likely stopped drinking now after Manor is sending her home.
So what? She stopped before. Never lasts long.
Must have been tough when she was drinking.
Went great when she was sober.
Did she hit you at all?
Is it? I'd have lamped her one if she had. She couldn't cope when Dad went to sea. And sometimes that was like 6 months. And then when the war started, she just went to pieces. The school told the Navy in the end, so they had to do something. Didn't bother her that we were worried as well. Then we had nightmares some nights, so I had to sit up with her. Mum was just laid out of her skull. Pathetic.
It sounds like your mum was having a breakdown, Maxine. Maybe she just couldn't help herself.
Oh, well, that's okay then. Don't worry about us. She was meant to be the adult.
Some people aren't as tough inside as they'd like to be. My dad, right? Hard as nails. He went to bits when my mum died. Got left with 2 young children. Couldn't cope. Some people just can't take the strain. Same as other people can. Doesn't make them bad people.
Makes them bad parents.
Maybe not as bad as you think.
How'd you work that out then?
Well, where's your mum been for the past 6 months?
Running away from it all.
Listen, believe me, if she's been getting help at the manor, she's not been running away from anything.
Dad's just died. She'll be back on the bottle in no time.
I'll give her a chance, eh?
No. She's run out of chances with me.
Well, if you won't come back for your mum, come back for Demi.
Demi? All I have to do is shout at her.
She knows you don't mean it. Look, I don't know you, Maxine. I don't know if it's going to work out with your mum or not. All I'm saying is, when someone's made an effort like she has, Maybe you should give her a second chance.
What did you say to persuade her to come back?
We compared childhood.
Maxine, the Manor have arranged for your mum to come and collect you.
Great. What's going to happen to my dad now?
Well, the police and the coroner will come as soon as they can. And then they'll take him to the mortuary and they'll get in touch with you about making the funeral arrangements.
All right, Mum.
Bet you any money the big one does a runner before they even get home.
Nah.
How can you be so sure?
Because that's what we expect her to do, so she'll do the opposite.
Well, we'll probably never find out.
Standing around again, guys. Nothing better to do.
A new series tonight explores the chronic disorders that leave thousands without a good night's sleep. The Sleep Clinic opens at 10:35. Coming up next on BBC1, Diagnosis Murder. The one to watch.
He's the last thing I think about at night, and he's the first thing I think about in the morning.
Panorama tonight.